our team is going to introduce themselves a little bit later, but I'll just kind of briefly give their names. We have Megina, we have Amanda, and we have Taylor. And actually, Beresford is our executive director. And our chief, he's our chief student. He, as well as being a leader, he loves to learn and he models how to learn and how to grow for us as well. So, all right. Welcome. And we're just introducing ourselves as far as state and name. Whenever you're ready. Welcome, Dane. Thank you for coming. All right. We can get started. Do you want us to close the door or leave it open? Because you know my voice travels. That's, yes, dedication. All right, so as I mentioned before, my name is Renee, and we are here to present Favors training. Just a few housekeeping details that everyone is pretty much well acquainted with, but I always like reminders because I always need reminders. The first is if you can silence your phone or put it on mute or put it on vibrate. I have to remember to do that with my phone. Also, just because of the flow of the information, we are going to provide breaks where you can ask questions. So from time to time, we will stop, take questions. So if you find there's a question, just hold your question until the break. It just helps with the flow of information. And then lastly, if we find that we run out of time and we have to, skip through slides, it happens to the best of us. All of our information is uploaded to the WOVA app. So it has our presentations and our handouts, and it also has our contact information. So if you want to follow up with any of us, feel free to do so after the presentation. So just to get started, the title is, it's a two-parter. It's the youth and family voice in the work of integrated partnership. This is something that Favors dedicated to, and we've experienced a lot of success with it. And in that success, we realized we wanted to highlight protective factors to strengthen and sustain a family-driven, youth-guided network of care. So that's a lot, but there are three key concepts: family-driven, youth-guided network of care. So I will actually turn it over to our team and they will introduce themselves. The first person is Megina. Go ahead. Thank you, Megina. And Amanda. Thank you, Amanda. And Taylor. Good afternoon, everyone. Taylor for statewide coordinator. Thank you, Taylor. And once again, my name is Renee Wright. I'm a family peer support specialist here at Favor, and I am happy just to start off with just a brief overview of our program and an introduction to our organization. Go to the next slide. Oh, I have the clicker? Okay. Do you mind? Okay. Thank you. Thank you. That's okay. All right. Okay. So as we mentioned before, for those who are not familiar with Favor, this is just a brief overview. Favor Inc. is a nonprofit statewide family organization serving families, children, and youth dealing with a broad spectrum of behavioral and mental health needs by providing family peer support and policy initiatives. Especially when we talk about family peer support, this is a big part of the evolution of our organization. When we first got started, the Family Peer Support Program was the first initiative, and back then, we called ourselves family advocates. Since then, we have evolved in our role to become certified peer support specialists, and anyone who is familiar with the field will know that it encompasses family advocacy, but so much more. The next part of our organization is that it was established in 2001, and it became fully incorporated as a private nonprofit organization in October 2002. So what I like to say is that Favor is part of Gen Z. So like a lot of people, we were conceived in 2001 and we were born in 2002. So we just turned 20 last month. You know, we're not old enough to drink, which is fine, but we graduated high school, can vote, and looking forward to the future. Okay, so this is just an overview of what we're going to cover in our learning objectives today. First, we'd like to present the evolution of the organization, Favor Youth and Family Engagement, the initiatives that we put forth to transform our system back home. Next, we'd like to discuss the challenges of integrating the family and youth voice in the sustainability of networks of care. Then we'd like to describe the programmatic elements and protective factors that sustain the integration of the youth and family voice. And then lastly, we'd like to explore how conducting family-led, community-based participatory research increases the authenticity of data, because it's not just about data, it's the authenticity of the data, and the role of the family organization. Okay, next slide. All right, so as I mentioned before, I'll give you a program overview. And first we'll start off with the Family Peer Support Program, which I am a part of. And then we will transition to Nagina's program, which is the Family Systems Manager program. So I see a lot of familiar faces, and along with familiar faces, we have familiar mantras. I'm sure we've all heard in all our states when it comes to the system of care, nothing about us without us, right? I thought that was just Connecticut's saying, and then I come here and I'm like, oh my God, everyone says that, okay, which is cool. I didn't know if you're familiar with no wrong door. That is also a system mantra, which is really big in Connecticut. And that is reflected in how referrals come to our Family Peer Support Program. The first is through the system of care. And what that means is that referrals come from care coordination, family peer support specialists, certified family peer support specialists like myself, and care coordinators work as a team in assisting families for a period of approximately 6 months. Then the next source is brief interventions. This means referrals are received from a variety of sources, including the family themselves, hospitals, schools, and other community providers for a period, and we'll work with them for about a period of 3 months. Something that we're very proud of is that a large number of our brief referrals come directly from families. Now, families, they take the initiative to say, I want Favor at the table with us. I want Favor to be involved. Many of the times they were referred to us by providers that they've worked with in the past, maybe a therapist or a community agency. But as I mentioned, we're statewide. So maybe a couple of years down the line, it's a different child. It's the same child, but a different need. It's the same family, but a different part of the state. We're statewide, so they know they can get Favor's support at the table with them, and they reach out to us. Another thing about our referral process is that family and youth engagement begins at the initial contact. Brief referrals receive a phone call from Favor's triage coordinator. The triage coordinator gathers the family story so they don't have to keep telling the story all the time. The needs are established and action steps are given to the parent/caregiver before being assigned to the family FPSS, which means Family Peer Support Specialist, in their local area. What's wonderful about that is that from engagement, the family knows that, you know what, they are part of the process. No one's coming there to do for them, and they are the ones who are moving the boat along, but we're coming alongside them to help to make sure it goes in the right direction and reaches the destination. Now, the next thing, which is really important, is that we have interagency crossover referrals and we have intra-agency crossover referrals. So interagency is the ones we mentioned. We may have, community agencies refer to us. Something that we find very helpful is that some people might call CPS, in Connecticut, we call it DCF, which is Protective Services. They're actually partner with us. And so at some point they like to refer, is if they close and they want the parent to have sustained support and success, they would even refer to us. So that's the intra-agency. Great. Now the interagency referrals is a great strength of favor. As I mentioned, there's someone here from each of the programs, and say if my family peer support program is working with a family and we realize that they need an extra layer of assistance through favor. So I might connect them with Amanda's program, which is the medical hold program. If there's some direct resources that are needed for children, especially with complex medical needs, there are a lot of them: diabetes, ADHD, autism, and so forth. Then we have Taylor. Taylor is a wonderful source of youth engagement expertise at the parent level, at the youth level and family level, but also at the organizational level. She is a great person to educate me on how to work with youth, because sometimes we come from an adult perspective and we forget, listen, the parent is having the lived experience, but the person living the experience is the youth. And their voice from the very initial contact has to be taken into account. Now, Megina's program, who I'm going to actually, kind of transition to right now, is family systems managers work as partners with peer support specialists. How that works, I always say, is that peer support specialists were micro. So we would go to like the school meetings and provider meetings and many, one-on-one meetings. But the family systems manager program, they're more macro. So for example, I'm working with a family and we're noticing it's not just the family, it's not just their child. This is an issue affecting children in that school, in that neighborhood, in that community, in that region. Now, I would bring a family systems manager on board to help us coach that parent to take their story to the community collaborative tables, to engage system stakeholders, and even take it to the state level. And we have a lot of examples going on there right now in our organization. So that is really how things work with us. And I have to say, one of the best things that I realized, and it may happen in a lot of organizations, is that Beresford always says, Beresford is an example of this, at least 90% of our staff have lived experience. So that means these are family members of youth with behavioral health needs, complex medical needs, special education needs. That includes our triage coordinator. So that first phone call is someone who gets it, even our office manager, our HR director. And then, of course, our frontline workers. And the reason I'm even here today is because Megina was part of my family's care team. And the way that she was able to engage my family and the youth voice was really instrumental in recruiting me to be part of the Favor family. So the next thing is, at least, I would say about 25% of our staff were parents who received our services. And so now they have evolved from parents who received our services to now parents who are providing services to other families. So that's, take it away, Megina.
The fun book because we are developing a community learning as we speak. Give your best contact information, as well if you have any questions or concerns. Am I not? Testing, 1 2 1 2, in a place to be. Clicker. Oh, thank you, Taylor. So here we go. Now, during this session, we're going to introduce you to tools that we use. Very honest conversation. We are an organization of 30 plus. So get out of your mind that we are rolling in dough. We're not. We are just committed to this process. And we are here to give you the tools and the mindset to go back to either challenge, your systems partners, even challenge yourself. Okay. So again, changes in practice has happened, and it has bolstered opportunities to encourage, strengthen, support, empower partnership and youth and family engagement and leadership at many levels. These little areas here, incentives, one way in which the system has bolstered opportunities. And in those incentives, those are monetary rewards. Again, rewarding the behavior that aligns with the practice, as well as issuing mandates, rules, policies, again, to support the desired behavior for the practices that we are trying to get better at. Compiling evidence, we know evidence-based, best practice, as well as opportunities to build relationships that increase the intent of cooperation and collaboration, and as well sharing information, increasing skills, being intentional about information power. So right now in this moment, this is the opportunity for us to reflect, because it's so easy and it's human nature to remember what's not working. But let's reflect on specific initiatives or opportunities that are existent in your area, in your district, in your state, in your town, in your organization. What is working? And what is the opportunity for growth, expansion, and sustainability? Just take a moment, get your little paper out so you could start writing down some real significant moments in this dialogue that we're going to have. So let's dive into the evolution of favor. The Family Systems Program was designed to collaborate at all systems levels. There was a disruption. This disruption was called Sandy Hook, 2012. Young man, 20 years old, and suffered from anxiety, obsessive compulsive disorder. His mother was his main caregiver, and 28 dead, 2 injured. What did that do? Well, Public Act 13178 was pushed into effect. And what that did is say that we have to develop a comprehensive implementation plan. And that plan must meet the needs of all children in Connecticut, emotionally, behavior-wise, mentally, and yet again, charging DCF, Department of Children and Families, to not only implement this plan, but we also have to look at prevention and reducing long-term harm. So funny, not funny, I was interviewing that day. Beresford was one of 10,000 panelists interviewing me. And I remember, phones ringing, and here we are literally building the plane for the Family Systems Manager. Family Systems Manager is the first in Connecticut. We see it more often now. You may, if you're searching, what's going on in the market, they're showing up on military bases now. They're looking for family engagement, things like that. So we were building the plane. And it almost felt like a jump start. You're here and then it's like, oh, now here we're going. So moving forward, I wanted to show a timeline of opportunities that we've come across, because again, I'm going to say we're a nonprofit, 30 plus, but the depth of work that we've been able to cover, the tools that we've been able to gain, The support that we've been able to receive to undergird the work that we do is phenomenal. And it's all because of collaboration. And it shows in the work. We pride ourselves on community-based participatory research, and we'll talk about that in the end so that you can take those tools back with you. The toolkit is online, so I'm going to walk you through it all. We've covered community conversations. All of the surveys that were developed, that was in partnership with our other partners. We had the opportunity, and our focus was making sure that family and youth voices were being heard. So again, you're doing surveys, let's not forget about our families. School system, the benefit for us was now not only is there a product for school-based diversionary, as an organization, a family-based organization statewide, we had the opportunity to go into these schools, speak with administration, and understand what are their challenges. And again, help them to understand why we need families to be a part of these discussions and what is it that we can do. And they allowed us to come in to do this research through community conversations. They allowed Taylor to go in and have hands-on with connecting youth and listening to them and pulling great information that again fed the school and made them think about what they're doing with certain things. As simple as fundraising. I never forget that kid. Where's the money going? I did my fundraising, but I don't see the money in my school. And as well, the creation and dissemination of dictionary terms. Now, I've in my other sessions with some of my peers, we know this helping profession is a bowl of alphabet soup. But what does that do for families? It intimidates them. They don't hear that. It's not inclusive. We're speaking our own language. So that again speaks to the opportunities that we've had to engage families, support families, empower families, as well lead them to decision-making tables. Continuing with the opportunities through this Connect experience, and Connect is Connecticut Network of Care Transformation. That was the initiative. And feel free to take a picture of Connecting to Care, CT data.org, and go on, because it may give you ideas of how you can create a centralized place for information for your families. Perhaps it will give your organization a new way of thinking how they're collecting their data, and again, allowing community to see what is being done, and as well things that need to be considered. I want to move down to the Learning and Leadership Academy. Pre-COVID, this academy looked like a place where families could come, they'll go through workshops, build up their portfolio, become certified as care specialists. They will shadow family peer supports. They will shadow family systems managers. But guess what? Another disruption, COVID. So here we are. What are we going to do? What does this look like? So it was just actually lifting what we've been doing in the physical space and putting it in a virtual space. We've had to move people around, having a coordinator for the leadership. And for us as an organization, the class, Cultural and Linguistic Appropriate Service Standards, that is a body of people. So you're in an organization, you have the opportunity to be a part of that cohort. Okay, so again, this is not money from us. This is collaboration. And we were afforded the opportunity to build into their cohort a section specifically for family engagement, the significance of it, so that every organization or grassroots that goes through the cohort, they get to meet with us, understand what we do, and as well, we have the opportunity to offer them technical assistance. Okay, so we're not wrestling with dollars here, but we're uplifting the power of collaboration. That, again, is the power of sustainability. So here we are, favor strategic planning. Do we have it all figured out? No. We become a part of the cohort again, because we need to look at our health equity practice now that COVID has uncovered so much. And I'm going to hand it over to Taylor just to, because she pretty much kept us organized and, you know, intact for that session.
I tried to do that with management. Just out of curiosity, how many people did a lot of hiring while we were virtual? Like while everybody was staying at home? Did anybody's organization bring folks on? You got, well, congratulations. Look at you, you're in person now, right? Crazy. But that's something that we knew a lot of people were going to go through, right? So with the strategic plan and the class, so the health equity plan that's what we call it at Favor, we had a plan. How many people also have plans, but they end up on a shelf somewhere? Right. How many people have their own personal plan and it ends up on a shelf somewhere? So we know what that feels like, right? So we had a lot of turnover pre-COVID. COVID happened. It was like, okay, we can give presentations on youth engagement. We do that. But how do we get back in it? How do we make sure that we are up to date, that our plan is effective, that we are doing what we say we're doing? So like Magina said, we went back through that cohort. Our strategic plan, so between that and, okay, now organization wise, what's our strategy? Because we know COVID showed a lot of people, you got to be able to pivot quickly, right? But if you have a strategy, you're better able to do that, right? You kind of have a vision of where you're going. So our strategic planning process started, officially, we started meeting as a committee, I believe late 2020. And that committee was comprised of board members, some staff, and a parent and a young adult representative. So it wasn't just the board making it up and then just dropping it in our laps. It was a full process that we discussed, we talked about, and we partnered with a consultant to help us write it because we don't know all of the answers, right? Does anybody in here know all the answers to everything that they got to do? No, at all.
Sometimes I think I do.
We think we do. And then we find out, I don't know what I'm talking about. So we partnered with a consultant. And so we went through in that process, there was a survey that went out to staff. They answer questions, anonymous, honestly, right? Because, you know, sometimes we think, oh, we could just ask and we're family, so you'll be honest. We know that's not the case. So that went out, and there were also families that were interviewed about the services that Favor had, what their process was like, what was their experience with us. And it also tapped into our funders and some of our community partners. So there's input from a lot of different places because we touch a lot of different people. So that draft was completed in August 2021. And again, it kind of got put up on a shelf, and then the world kept moving. So we went back and revisited that in August, this past August, and was like, okay, what are we doing? Where are we going now? Right? So what we did for management was we asked 4 questions. If it was up to you, what is the plan that will lead us to sustain Favor? What is the plan? What's your plan? Budget aside, what would your idea be? And what's your idea for each of the programs? What's the input? What do you need each of the programs to do in order to make sure that that plan works? So we did that, and we had some long discussions. We had some long discussions about this, but it was necessary, right? Because we also wanted to make sure everybody had a part of that. so that no one could say, oh, I don't know what you're talking about. No, we sat and we talked for about 4 or 5 hours about this, right? So everybody had buy-in. And so currently, this is an ongoing process. And I'm gonna say this right now, we're not gonna put it back up on the shelf until next August. So I'm in constant communication with our director of operations, with our ED about, okay, so where are we in the process, right? So just as we recommend and strongly encourage any of our partner agencies to constantly do that reevaluation, we need to also lead by example. So we are also beginning to do that as well. Strategies are coming together, slowly but surely, but they're coming along. So I'll hand it back over.
Thank you. So again, let me remind you, we're a nonprofit, 30 plus, majority of frontline workers. Okay, I just want to keep putting that out there and you'll see why. So another thing that we took control of is workforce development, making sure that families are seen as full partners. And again, guiding the conversation. In this workforce development, we pay attention to a logic model. Some of you were in a session with me yesterday, preparing families for participation, and you would think, why would I be in that type of workshop if that's what I do? It's because we don't have all the answers. Families are ever evolving and people are doing things. And so again, collaboration is the key to sustainability. So we have workforce development and we focus on cultural, linguistic, appropriate service standards, which you're able to download that toolkit. There are 15 of them. These are national standards, and identify 2 or 3 that you may want to bring into your organization. I'm saying organization right now, but as we move forward, I'm going to start chipping it down to the 3 people you may have lunch with that work within your division. Okay, so I want to kind of give people an idea. It's up here, but I just brought along with me to give you an idea that we have 25 local level system of care tables. The map is the way that our Department of Children and Families see the state. Family systems managers and family peer supports are stationed, well, they have a region and they focus intuitively and with intent. These are our service sectors: education, child welfare, substance abuse, juvenile justice, mental behavioral health, pediatric, primary. I'm also going to add other, which is grassroots. I have such a heart and mind for grassroots. They do a lot of work. And when we also was able to receive a network analysis, again, we don't have the money, but through collaboration, surveys were sent out to different providers. Network analysis helps us to understand the frequency of our collaboration. And Amanda will touch on gauging in a little bit. But again, do we only collaborate when there's funding opportunities? Do we collaborate only when there's holidays or if there's a disruption? Or is it an intentional practice, whether it's outside of the organization or within the organization? As a frontline worker, I remember if I had to attend a therapy session with one of my youth that was, on my caseload, I needed to know who was in that building. Because again, that affords another opportunity for me to network, not only on behalf of me, the work that I need to get done, but the family that I'm trying to, build, supports around. So how many of you heard of community mapping? Have you used it? Is it an intentional part of your work? Would you like to share? Oh. Thank you, Taylor.
Sorry, thank you. With our organization, we used it. It was used to look at the different regions across the state and to be able to see where there's a need to place specific FPSSs in certain location. So Maryland is a very small state, but we have large counties in those small states. So they just wanted to map out that area map out areas to be able to determine where targeted families are, where the services need to be implemented, and how many FPSSs to put in specific regions where those needs were. So that's why they created, or that's why they utilized the mapping system.
Okay, thank you. Anyone else?
Your counties have somewhat of their own autonomy.
Baltimore City just says it in itself. Yes. Everything stems around Baltimore City. That's our targeted area. That's the region that I manage and supervise, the teams that's there. But the outskirts, it's not nearly as yes, not nearly as harsh as Baltimore City. But Baltimore City set the tone for our organization and what type of services we need to implement, how many families we need to put in, what kind of partnerships we need to establish. So that's what we did in Baltimore City, and then we mimicked from Baltimore City and just took it across the state. It's called Maryland Coalition of Families. I've been with them for 3 months.
Oh, nice.
You don't gotta say it like that. Does anybody else have any, want to do input about
Thoughts?
community mapping?
Okay. So it highlights people, organizations, institutions that can be utilized to create meaningful service projects and collaborations. But I'm going to say something. Within the team, my associates, I like to call it canvassing. And I will let you know, Excel has a great canvas. Taylor, stop it. They're still getting used to it, but again, it's free. It's a good tool. It highlights, it counts the days for follow-up. It's in Excel. So when you're looking at assets in your communities, libraries, school, after school programs, parks, make it meaningful. Okay, I'm trying to chip away at your humanness in here, because in our positions, we get comfortable and we get used to the flow of things. But in the helping profession, you have to ask yourself, are my connections really meaningful? All creations are built on partnership and creations. So make it meaningful. When you identify assets, give them context. Give them context. We're just not looking just for the sake of looking. Give them context. Why are they assets? Who are they assets to? Because when you come across a problem, problems can lead to the deficit, and solutions will be present. It will, when you put your assets in context. And we'll talk about that as we go on. So again, human nature to know what's not working, but how about how we were able to embrace the challenge of integrating family and youth? So pre-COVID, we knew families had technology issues and concerns, right? However, COVID, a lot of our youth lost their connectedness, their natural supports, as well as families. Frontline workers that they relied on, that they had relationships with. So there was a lot of loss that I'm sure that you guys can relate to on this list. Identifying service needs, gauging outreach. And so please, ladies, feel free to chime in. Do you want to talk about anything on this? Sure.
She wants me to talk about our gauging outreach. We are the medical home initiative part of Favor. I started here in 2020, and I started in January and was sent home in March. So I knew nothing about what was going on with the program. So it was a learning curve for me to understand all of these programs and how we all work together. It took me a while, but At this point, we do a lot of outreaches since we've gotten through COVID. We also did them during COVID. We actually went out of the office. I think we were one of the only groups that left the office and went out and did outreaches with our masks, and we really went out into the community. Anyone that was still having an outreach, we went to it. We did a lot of virtual outreaches. But we have a respite funding program, which you get applications for, and the families can apply for the respite funding for a $500 grant that they are allowed to get every year for respite. They can use it for camps. They can use it for equipment. We had about 263 applications or checks that we sent out in 2019, 279 in 2020 to 21. We are now in 22, and we knew that there was going to be a snowball, but I guess we weren't gauging how many people were going to snowball into this year that we're in now. So we've already sent out 100 checks. We have 156 people on our waiting list right now. So before we even get to November, we are already almost at capacity of what we can use for our funding. So I guess, Magin, is what she's talking about is gauging how your programs are going to be moving ahead. We were not expecting this kind of movement forward in both of our programs. I run the extended service funding program, which is, it helps families that are not able to get on our Husky program if they're undocumented. We'll cover their medications from birth until 21. We started with 15 to 17 kids when I started. We are now over 40. So that program is also moving ahead, and that's a little harder to gauge because you don't know how many kids are going to be referred to us. All our referrals come from hospitals and care coordinators. We work with Yale, New Haven, Stanford Hospital, Hartford Healthcare, Connecticut Children's. So we get a lot of referrals that come from these social workers and care coordinators in the hospitals. So it's very hard to gauge this, and you only have a certain amount of money that we're allowed to use on a yearly basis. So right now we're in a little bit of a thinking area with our funders, which is the Department of Health, on how we're supposed to proceed ahead. Do we continue to go out and do outreaches? Do we continue to tell these families we have funds that we do not have now? So right now we're working with our funders to find out which direction they want to go in. Do they have more funding for us? Possibly. A lot of people got fundings, possibly not, but we're working on that. So I guess that's the area that you need to look ahead, because we just don't know what's around the corner. So.
If I can add something also, we solicited the services of financial agents through our books. So although this is the first time that our program has really gone over its budget. No, yeah, you're within the parameters of 20%, so you're in a good place. But I want to share one thing about Amanda, and it's a personal thing, and if you get upset about it, talk to me later. You can cuss me out later. Amanda, before she came to us, she worked for a bank that we bank with. She actually handled our banking needs, finances. I went into the office one day, into the bank one day to change signatures. And she asked me if we were hiring. And then it turned into her working for us. So I guess, at least in one person's mind, we are a better place to work for than a bank. All the money they got.
So looking, that's right. So in this, again, looking at embracing challenges, what I'm doing is I'm encouraging you to think outside of the box. You know, how you entered this room and how you leave is pretty much up to you. How effective you want to be in your field. Just because you're a frontline worker and not, you know, in management or, again, what is your intent in this? Because we're not going back to the way it was. COVID has unearthed a lot of things, and who you want to be in all of this, is greatly determined as to your networking power, how well and willing you are to collaborate, and understanding that that is the power of sustainability. So we wanted to be open and transparent because, we didn't want to come here with unicorn and, rainbows and stuff and paint this image that we have it all figured out. But collaboration is a big part of it. So again, I believe this is the last one, service deficit and surging demand, I think, yes. So again, in embracing challenges, service systems often do not have remote technology capabilities to continue their work with children and families as needed. And I think this was a good area for Taylor, if you wanted to share challenges as it looked with connecting with youth.
Oh, yeah. Yes. So prior to, and I don't like necessarily saying, oh, pre-COVID, post-COVID, because we're still very, as soon as this is over, my mask goes right back on. We're still very much so in a pandemic, right? So we're in the middle of it. But before COVID, it was not difficult at all to partner with there was usually a teacher or possibly like a school psychologist or social worker that wanted to come in and either do a community conversation, which like Magina said, we'll get to a little bit later, and then or training. One of our trainings was created to be able to adapt around a class period. And so it was a lot easier to be able to say, oh yeah, I'm going to Manchester High School. Oh yeah, I'm going to be in Bridgeport. Oh yeah. And then COVID happened and it was like, I'm not going any of those places because everyone's online, just like we were, right? So it became a lot more difficult, and it provided a challenge, right? So who are the young people that are still meeting, and how are they meeting? Where are they meeting? Who are they connected to? So going back to that community mapping, I really relied on my partners, my FSM team, to be able to say, okay, Taylor, these are the groups that are still working, that are still meeting together. They may be outside at a park if it's nice out. So really, thinking about it outside of, okay, so if because I don't know if anyone else feels the same way, just because you build it does not mean that they will come. That is not how that works, especially for people in general, but for young people, they're competing with so many different things on a normal day. If you have 3 options virtual, I'll tell you, I would not have signed on to any of them. I'm tired now, right? So it posed the challenge. And I wanted to ask, how many people in here prior to the pandemic were never discussed virtual anything? Was virtual like not an option? Right, never did virtual. Then all of a sudden, how many people had to pivot like that? How many people have had the days where I say it was Thursday on my calendar, where you've got a 9 straight down to 5, and it's like, when are you gonna eat? Oh, I'm gonna eat. My team will tell you, I'm telling you to take a self-care. There it is. Listen, oh, you need my camera on? We're gonna eat lunch together. I don't know, because I'm hungry now. But there are people who are like, I don't even have time to use the bathroom. That's wild. But those are things that we had to go through. How many people are hearing a lot more conversations about, oh no, virtual is not going to be an option anymore? So it's like, okay, well, we had to pivot, and something that may have been a benefit to families and to young people is now trying to be pulled back, right? So that's a part of our push to make sure that, no, we need to have this as a hybrid option. You want it in person, great. But also all you have to do is plug in your computer, right? To make it so that more people are able, because we opened it up a lot to the state, things that were regional, because I know you all saw the map. The Eastern region, is it a third of the state? It's a lot of the state. There's one family system manager that covers that whole region. So if something's at the top, everybody's not gonna be able to drive an hour and a half to get there, right? So really making sure that we're not letting it go back to, oh no, it has to be in person. It doesn't have to be. We learned that for 2 years straight.
Doesn't have to be. That's right. So again, in embracing the challenges, just as I said to you, as you are canvassing, make it meaningful. give it context, because problems will lead you to the deficit, but at the same time, solutions can be identified when you put things into context. And when I say things, you're canvassing. Who are you connecting with? Does their mission align with your organization? Does it align with what you are hearing from families? And now you can make these connections, because there's no silver bullet for one organization. We had the opportunity, okay, let me be honest. So I get an email from the executive director, right? So Associate Commissioner Schomburg is going to be in Connecticut, Department of Family and Children. They want 10 families because she want to sit down and she want to understand the experiences of the families, that what they're having with the department. Literally, we had we could say a week, but there's a weekend in between, right? 10. And so, across programs, families were identified. So here we are in this room, and I'm listening to these families. And again, these families had to have had experience with the Department of Children and Families, good or bad. And I'm listening to them, and I'm quiet, because this is an opportunity for me to see the challenges, the deficit, so that I can get back with my team and start identifying assets in the community, put context to it, so that no family would have to go through this again, or we can, cross somewhere and ask those questions when it comes to the social workers and how they handle the families. So that was an opportunity for me to turn my program around and to engage my team into an immediate need, just listening to these family stories. So that is the action that I'm trying to communicate here, whether you're a frontline worker and you have, colleagues that you sit together. What are some challenges that you come across as a frontline worker? Why does your experience have to be minimized? You still have to be at your best to serve. So whether you're talking about yourself and the quality of your work, the quantity of your work, or the families and youth that you serve, there is opportunity in canvassing. And I do have, there's a downloadable toolkit for community mapping. I tried to find something that was very simple and basic, because it doesn't have to be complicated. And so we can pass it, yeah. And I have 2 different copies, but you can download it as well. And hopefully that will generate ideas for you. So again, assets in your community, libraries, resource centers, after school programs, parent teacher organization, and faith-based. That is another valuable area. My executive director doesn't know yet. I've only had conversation with the statewide person, FPSS, and one of my associates. I've been trying to tap into faith-based for quite some time, for years. And this will lead us into protective factors. And I wrote a proposal years ago, maybe 7 years ago. It was only just last Saturday, I was invited to be a part of a discussion at a faith-based, and it was the health and wellness ministry. And I sat and I listened to these women who have been a part of this ministry for many years. And they said, okay, well, we have someone new joining us. Yeah. So, okay, so now I'm talking and, just sharing small bits, but also being reflective of what they said. And this is the thing. They have given us space, May, June, July, and August. Taylor just told me, don't forget about September. May, we know is Mental Health Awareness Month. June is Men's Mental Health Week. July is Minority Mental Health Awareness Month. August is National Back to School Month. And then September brings us to suicide prevention. Well, now the family systems manager in that region We're going to sit down. We're going to develop activities that are intentional for community. FPS will be right along with that journey. Statewide collaborations right along. Presentation from medical homes. Faith-based is an asset. They have the space to house you. They have the families that are in need. We're not talking about cost. This has nothing to do with funding, but it's collaboration. And that's not where we're going to leave it. We're going to build this data and create a blueprint and move from region to region, whether it's 1 or 2 charities. We're not trying to be greedy. We're trying to set an example, and we're trying to create a space for frontline workers as well to be a part of these larger conversations. Because another thing we notice when we're in meetings, it's management. I had dinner with one of my colleagues, DCF worker, and I'm like, yeah, I was like, so what do you guys think about family first? And he's like, what? I'm like, yeah, family first, kinship, he was like, yeah, we talk about kinship. He said, but family first, what? And I'm sitting there, I'm explaining to him, and he's worked in the department for years. That's how we met, actually. We had a child, we shared a child. I was the care manager, and and he had no idea what I was talking about. Frontline workers are being left out of these conversations, just the same way we're saying families are left out of these conversations. So it's important for us to create the blueprint, because we are saying, look, when you invite us into organization, we don't want to talk to management, because the teams are invited to leadership meetings. We're part of we don't want that. We want frontline workers, because there's no reason why work has to feel like a burden. It becomes discouraging. This is cancel culture. Many are saying, forget this. I'm leaving this job. Why does it have to be so hard? So we want to create a blueprint. And again, collaboration has allowed us to do that. So let's get it. Okay. All right, let's breathe. Sorry. Yeah, I know. Is everyone okay? Please. Taylor's always gauging me, because I go straight through, and she's like, Regina.
In some of our rural areas in Maryland, we're finding it kind of hard to penetrate some of the faith-based organizations in certain communities. Could you please share your tactics and strategies on how are you?
Did you not hear me say it took me 7 years?
I mean, if it's going to take me 11 years, I just want to know.
It was the conversation, and everything's not for everyone. And I always look at the work as dropping seeds. Some's going to fall on hard ground, and that's how I see this opportunity, because I didn't separate myself. And it's not just only me, because Renee was with Pastor Eric, longtime friend. And then we have the Western FSM that has. So it's time, because they're also looking at you. But this is the thing that COVID did for faith-based. It's challenging them to do better. And I see that now's the time, it's prime time, because they will lose if they do not change, how they are conducting, and engaging community. So it is prime time. So I wouldn't say give up. We've sent letters, just introducing. When COVID hit, we developed these letters just introducing. I've gone on and, just found churches, but they have contact us, but it's kind of general, did that. And then here we are now. So it's just something you have to continue. Mm-hmm. Yeah. And when they write their proposals, they have to put in their collaborative. So it's always good to hear, seeing a church in the media paper, they're doing this here. Well, that's the pastor understands, and that's the pastor approach at the same time. That was personal. So if you know someone who's part of the congregation as a leadership, they're good experts.
one of the things that's helpful is you don't have to get every pastors. A big believer in positive peer pressure. If you get one or two pastors and you pick them up, highlight them, that's fun as a businessman. Pastors are like, oh.
And just be clear.
Oh, and Beresford also a former pastor.
Churches are still one of the most segregated institutions.
Yes.
Mhm, mhm.
But also in Beresford, can I say, what we have found, we've been very fortunate with, like Beresford, we have many system leaders who are also pastors, working at pastors. So they, Pastor Eric, he's also a school. You know, we have pastors who work as care coordination trainers. So you might have pastors as, you know, lately, sometimes listening out and say, well, you know, who was a personal trainer? But they work in the system and connect with them, perhaps.
We have 2 questions over here, and then we're gonna keep it rolling.
Okay.
Okay, I'll start real quick with a comment because one thing that we found was getting to the pastors through their youth pastors by engaging the youth that then talk to the youth pastors that then push the pastors. That's the only way I've gotten in, and that was a light bulb moment for me where I was like, oh, duh. So anyway, never thought of it, but it was because they were more receptive because they were seeing the impact of the youth and how it was working. So, but my question actually goes way back to the
Okay.
beginning,
It's okay.
because you had mentioned about your triage coordinators and that's that first intake piece. So my
Renee.
question is like, I know we talk a lot about the systems work and how we re-traumatize families a lot of times by that repetitive telling of the story and the explaining it all. So is it integrated in a way that that story tracks with the family, and how do you get around all the HIPAA, like how is, you know, all the permissions that have to go with that?
That's an excellent question. And definitely when they do the referral, they sign a release, of course. And like I mentioned before, our triage care coordinator has lived experience. So, you know, when they take that story, knowing, you know, I think lived experience is great, what not to say. So we've never had a parent be intimidated by speaking with a triage coordinator. And then that is noted in the file after triage. And when it gets sent to us, assigned to the peer support, we see that. So when we do follow up with them and begin the consultation process, which would lead into the intake and the episode of care, we already have a lot of background. Yeah. And okay, well, I can tell you based on us, and you can say for the answer. Again, another release form, and definitely a conversation. Everything is a conversation with the parent, because we do have parents who are like, I don't want the school to know my child is seeing a therapist. And guess what? We're not going to talk about that. We have parents and their homes are falling apart. They don't want the school to know that. But yet sometimes the parent wants someone to share that story, but tell it to back them up on what they're seeing. So it really depends on what the parent desires. Yes. And your point about the youth pastor is excellent, because Pastor Eric, if you're listening, he is a youth pastor. And that's a really good contact. Any other question? Ah.
6.1, I'm loud enough. 6.1 grandchildren are being raised by grandparents. So if you go to your senior centers, again, a lot of the seniors go to the churches. That's where they are. If they're raising a child or a child with special needs, work with the seniors, because we go to the senior centers. There's a lot of things in Connecticut that they offer through our senior centers. We have done outreaches every year, and we have gotten multiple grandparents right now. So we're trying to figure out a way to actually reach more of our grandparents in the state of Connecticut, because we have 68,000 grandparents raising grandchildren just in Connecticut, and that's a little state. So that's another way.
All right, switching gears, protective factors. We want our families to be successful. And so, yes, we looked at the challenges and we're considering, again, putting things in context. Why is it an asset? Who is an asset for? 5 protective factors here that we have are the ones that we identified with, and just based on research, they're the 5 that stand out the most. I want to share something personal. I was sitting with these wonderful women last night, and we're just talking. And protective factors, again, we're a helping profession, and we're always willing and working to help families. But have you thought about the protective factors for you within your organization, within your family? It's going to be 5 years. I'm a cancer survivor, still fighting. I was diagnosed stage 4. And last night I looked around the table and I told these women, I said, wait a minute, I've been thinking. Taylor knows when I'm on Zoom and I'm looking this way, she understands what's happening. I have visual cues in my house because immunotherapy has affected my vision. She knows if I'm doing something with my eyes, she says, close your blinds, turn off your light, get off Zoom. Amanda with her banana bread, because there are things that I can't eat. But between her banana bread and Taylor's banana pudding, I am so good. I still do treatment. We fly in on Sunday. Tuesday, I have treatment. I go to Renee's house. Her mom makes the best steamed vegetables. I call her mom my surrogate mom. She's been on this journey. And so within organization, I do not miss information. I don't miss opportunities to collaborate. I don't miss opportunities to relearn information. Taylor could tell me something today, and she knows we'll revisit it again next week, because that's the way my mind works now. I stand here before you, I have papers, and you're probably thinking, did she not prepare for this presentation? I could lose a thought in the middle of a thought. So I wanted to be respectful of time. So I've grieved me. Our families grieve themselves. When we have children, we don't think we're gonna go through all these challenges. We thought, I'm gonna be a school teacher. I'm gonna, buy a vacation home, and we'll be there in winter months, and then boom, disruption.
Yes.
What are the protective factors that we lay for our families, but also for the organization, our frontline workers, us as managers? That's important. So I wanted to just put that out there and be transparent that, although we're up here looking sassy, I just realized last night that these women, even down to my children, my daughter, when she started to lead the discussion around racial justice in the town she went to school in, call Taylor, talk to her. Her and Amanda bonded off over knitting. She knows all my children, because sometimes my mind, and it's okay to say I can't. So do that for
On
yourself.
that same note, I know as we talked about parents becoming providers, we now have engaged young people to be our interns. We have graduate interns. And I always say Magina's children were our first interns.
Yeah, they were.
Like every time we have trainings, her kids would be the one laying out the juice and putting the tables and the chairs. And so, and also to her point about health. At my first 3 years at Favor, every year there was like about 2 staff persons diagnosed with cancer. And I'd be working with parents. At least 2 of them were diagnosed with cancer or another autoimmune illness. So we do see that mirroring, because we are a family organization, so we can learn about our families by working with our staff. And we also realize by serving our staff, our families, we are also serving our staff.
So everyone in this room is in the helping profession. So let's talk about the protective factors we have built within the organization. Again, I'm going to say it, nonprofit, 30 plus, under 50, under 40. We're just 30, what, 36, 34?
I think it's 31 now. It's only 33 when we put our interns on the email list.
Okay. And yes, we have interns. Taylor, she guides, she leads. We've reached out to colleges and universities as well, and we're training them to understand data collection, where, again, collaboration. So we're pulling from all different places. And again, it's how you see yourself in the capacity of your organization. So here we are. So we expanded training with language assistance services, providing remote supports to both children and families to build protective factors. And what this looked like is, so before COVID, we had family calls. This was a conference call once a month. Families will come on. Patricia and another young lady, Jules, from a partnering organization. They were both in the same region. They would meet with these families, conference calls. Families could ask questions, any issues, concerns that they may have. Now we're virtually, and we're revisiting this conversation, this technique in our workforce development. What we would like to see happen is create this virtual space where we can pull in some providers, things that are really relevant and maybe more sensitive and can't really be discussed in depth at the local level decision-making tables. Like, for instance, we partnered with First Episode Psychosis, Dr. Laura, and her team comes out and we identify families and providers to be a part of the presentation. And they talk about first episode psychosis on a basic level. And this year they added a part 2 for providers. And now we're just trying to open up space for conversation, for questions, so families could really, again, the stigma around mental, behavioral health, but to really understand what this looks like. So those are, the collaborations we want to bring into the virtual world, and we want to call it an Our Power. I don't care, take the name. You could take the name. Our Power, once a month, just again, to identify families who need this space to not only receive information literacy, but to ask questions and understand where the opportunities are. So we've given ourselves a 90-day assessment. We just talked about it in workforce development last month. I facilitate that group, and the address for connecting to care, we'll roll it back later so that you can go on and see all of the work groups that were built through this timeline of collaborations, and understand what the work groups look like. And again, bring it back. Maybe you might, want to give that idea. Okay, so, and then, so that's around training, engaging youth. Let's go to the next one. And so again, so the downloadable tools are the canvassing, community mapping, and the next one will be the class toolkit. But there is another tool that we did not put on to be downloaded because, again, Taylor will tell you why. It deserves conversation. It deserves your questions. And we wanted to be sensitive and conscious, and, just make sure we were meeting your needs around youth.
I'll do the brief overview now because I'm looking at the time. We've got 8 minutes because it's Friday afternoon. So it's the youth engagement assessment tool. So what we do oftentimes is, or we'll hear a lot of folks say at tables, oh, we need to engage youth. Okay, what does that mean? If I ask somebody in here right now, just one person, tell me, what does it mean to engage youth at your organization?
For us, I would just simply say, which is at the basic level, because we're more macro right now, it's just create programming for youth. Literally, that's it.
Perfect. Okay, one more person, and then I'm gonna just talk as I walk.
So at our agency, we have a program called Boom Youth. And the premise of that is to elicit thoughts and ideas around how to make systematic change from a mental health perspective. And so when we look at engaging youth, our idea is to take their thoughts, their words, their ideas around how our system should be functioning and then implement them through our system of care.
Okay, so on both of those, there's no right or wrong answer to any of those questions, right? But when we say, because you have to understand some places are more macro, like we are, our program, you're on different prongs of the ladder of youth engagement, right? But sometimes people will say, oh, we want to engage youth. Well, your meeting's at 10 o'clock in the morning on a Wednesday. What you want to do? How many people, you said this before already in the meeting, I can tell, right? We should probably change the time. Well, this is the time that works best for everybody here. Well, no young people in the room. So, right. So these are things like, even for what seems like low hanging fruit to a lot of us, like common sense, common sense ain't common, but it's often something that's a barrier, right? And it's used as an excuse. So this assessment tool is really meant for organizations, for folks, whoever is deciding, oh, we want to design a program, or the signers of contracts, to say, okay, we want to do youth engagement, but what does that even look like? Are we ready for that? Because if a 16-year-old comes up to you and is like, listen, this ain't right, you're doing this all wrong, some people are not going to take that criticism well, simply because it came from a 16-year-old, right? So what does feedback look like? If somebody says, I don't like this isn't going to work, do you take offense? Because you're probably not going to be ready for young people to tell you. So really getting into some of those, and it's meant to be to have a discussion. So then the group, like I mentioned earlier, like what we're doing with our strategic plan, everybody adds to this discussion. Everybody comes up with that strategy. Okay, so what level do we want to cap our engagement at right now? How do we define that? Because engagement could just be, oh, we want you to give us your input, but we're not going to tell you nothing, or we want you to make decisions.
How do you balance, the engagement or with, the information you receive from the youth to put to like your organization's plan? Like, how do you make that balance from taking what they said and, their criticism?
Oh, that's how we're ending.
How do we balance it? Well, one, how much do you value it? Right? Because if you say, oh no, we really value the input, and if they've given you a list of everything that you're doing wrong, and you're like, I'm not gonna do any of that, you don't value it. So there's no balance. There's not going to be. Right. It is all about intention. I was at a conference last week that they said, put your money where your mouth is. We get paid to go to work. If they're giving input, we should also be paying them too, right?
All of the system of care meetings for my organization and our community are held after school hours. There's absolutely no exception to that. I actually was interviewed by peers. So our peers and parents were the strongest part of my interview process. I also was interviewed by system supports. I was not interviewed by anyone in my agency. And so the strongest voice came through from the parents and the peers, and they were the ones that were hiring me into this role because I was going to be their biggest voice. And so we've created this network for them to sit on a platform that is around their schedules and around their timeframes where they're available, because their voice is the most important. Michigan.
Nice. Yes. All right.
All about connections, right? So this is going to be a connection in a minute. I feel it.
So again, a fun book went around the room. Put your contact, questions, thoughts in there, because we are developing a learning community right here as we speak. Okay, so let's move forward. There are toolkits that you can download. We have 2 hard copies here, and this is how we're going to sum it up around health equity. Now, the national class standards, okay? The intent was to provide guidance on how to provide cultural and linguistic appropriate services in health care settings and in health. As well, operationalize concepts and provide concrete action steps for professionals and organizations to promote a consistent and comprehensive approach to providing class and provide some consistency in how class should be implemented. You can take this, you can adjust it. There are 4 pages to call your attention to. Page 59 is the 15 national class standards. 77 is creating an inclusion statement. The goal is to become an organization where diversity and inclusion are a fundamental part of values and cultures of programming. Page 92 and 93 is around community-based participatory research. Now, we talked about creating a space to know the experiences of families, but let's go back to what about frontline work? That could be a simple focus group. Understanding what your barriers are, what are some things that are in need of improvement, and what are the recommendations? That's in a book. The questions are there. You can modify however it will work for you. And then there's another one for family focus groups that you can do with some of your families as well to keep, or the youth, to keep the conversation going. You have the data there and it supports the changes that need to happen. So you will find that in the class toolkit for you to have, for you to use however you may need. And so, and again, we're not talking about money. We're talking about conversation. We're talking about the relational experience of the people who are experiencing the system, frontline workers who are experiencing the trenches, the decision-making. It's there. What else do we have? And we're gonna end with Taylor.
So we just went over real quick the youth engagement assessment too. But if anybody wants to talk about it later, we'll make sure that we reach out, or you can like put a star by your name in the fun book, right? To make sure that we can stay connected. But since we just ran through that, and I thought about, so your question about balance, I think part of it, we have to just really be honest with ourselves. What are we really trying to do? We know what the work is. We know what the jobs are. We know what the work that we're supposed to be doing, but how honest are we being when we're talking about parent and family engagement and participation, leadership? What does that really mean to us? And the same thing for youth. And also just to remember, youth engagement, young adult engagement it's a different kind of intentionality, right? It's not just like, oh, we're coming fully prepared. No, you got to put in the work. We expect families and young people to come ready to just jump in. We have to do that work as well. So we are at time.
Yeah.
We thank you. We
Thank
thank
you.
everyone who has come, who has participated, asked questions.
Any questions?